Hi all, let's have continuation of last class that we were discussing about different types of psychophysiological measurements, right? So in that next type is peripheral nervous system measurements. So peripheral nervous system measurements here we will be focusing on extremities, right? So in that case we are here taken into consideration that is skin related equipments, that is skin conduction conductance response. So there are different other name also there for this particular technique. One is galvanic skin resistance, or you can say galvanic skin response. So in such case, in such technique where we will measure the changes in electrical conductivity of the skin, which is related to different emotional status. Okay, so for example, if you see the person when they are so panic, automatically their sweat glands will get activated and they seems to be so sweaty, right? So that reason is because of this electrical conductivity of the skin is somewhere it has been related to the emotional status of the person. So through this physiological response, we have the possibility of measuring psychological parameters. So that is the reason here we are taking skin conductance response again to measure psychological parameters. Okay, so the application of this skin conductance responses, like we can assess different kind of arousal state, that is hyperactivity of particular person, and we can measure emotional response and automatic nervous system activity and too. So and advantage of is that we can have very sensitive we have very sensitivity to even minute changes in the emotional state that we can do by means of this SCR technique. And the limitation also, and why not, it also have some limitation, that is it can be easily influenced by factors such as temperature and humidity. Okay, so if you're having very closed room without any fan or something, if the temperature is very high, in the sense automatically the people tend to have sweat, right? So that sweat, it's no way it's been related to the emotional state of that person. So this kind of factors will influence the results of this particular method or technique. So and then next parameters or next technique which we can use to assess psychological measurement is that respiration rate and depth. So the reason is that when they are like so nervous, when they are so happy, automatically you have some kind of influence in respiration rate. Okay, so they have some high breath rate or low breath rate, or you can see some changes. Okay, that kind of changes will give the information about what is the emotional state of particular person, or you can assess the stress level of the people. So the advantages of this particular technique is that it is very easy to measure compared to all other techniques. And also limitation, we have certain cases that for example the physical activity and anxiety will interfere the original result of this particular technique. The reason is that if the person is like a having some investigations or interrogation, if the person have to walk all the way to certain distance, certain kilometers, and they have to climb the stairs for a certain steps, and then followed by if the person is attending some interrogation or investigation, because of this physical activity what they have done before investigation will influence or will interfere the respiration rate. So in that case, that respiration changes because of this physical activity, it is nowhere related to the emotional status of that particular person. So in that case we have to we have to make the person like be calm for a certain time or certain duration before going into some kind of test. So these things we have to be taken into consideration when we are going for respiration rate or depth techniques. And then last and final technique is pupil dilation. The pupil dilation, here we are focusing on the changes, size changes in the pupil. So the reason is that we have a capacity of pupil to like enlarge in size and then shrink in their size. The reason is that when we are very keen to listen some, when we are very keen to see something, or we have to give 100% attention, if you want to see something or if you want to listen something, automatically our pupil size will get increased. I'm giving some simple example that if you want to see anything so clearly or so attentionally, in the sense we will make our eye like to dilate as much as possible, so that the all possible amount of light rays will get insight into the eye, it will fall on retina, so that we will have a very good perception of what we are seeing. Okay, so that is the reason here, when we are very so conscious about something, when we want to do something at 100% attention or conscious, we will have that kind of changes in our pupil. So okay, even when you see something so interestingly with so 100% lovely to some things or some objects or some person, eventually we have some changes in the pupil dilation. So from that pupil dilation we come to know what is the emotional status that person is going through. Okay, so this is the thing we will be measuring with the help of pupil dilation. And as like other techniques, here also we have advantage and disadvantage. The advantage is non-invasive and can be measured remotely, and the limitation is that it can be influenced by the factors such as lighting condition or the individual difference. It may vary from person to person. Okay, so last and foremost is what are the other measurements. Apart from this, we have certain other measurements which also give some kind of inference to measure the to assess the emotional status of the people. So what are the other measurement? In the sense, we have electromyography, that is EMG. Here we have a measurement of electrical activity of the muscle. Okay, it's providing the information about what is your muscle tension and then arousal, that is the hyperactive peak state. Okay, and the second is the salivary cortisol. This is the particular it's a chemicals which is being released or present in the saliva. It's a hormone, this particular hormone, that is a chemicals which is closely associated with stress and arousal. When they are so hyper or when they are so stressed, in that case the level of this cortisol hormone, it will get increased. So by measuring this cortisol hormone, we will come to know the person is what kind of emotional status they could be. So this is the second thing. And last thing is blood oxygen level dependent, that is bold signal, that we can measure with help of fMRI, that is functional magnetic resonance imaging, which is help to measure changes in blood flow related to the brain activity. So based on our brain activity, our blood flow will get changes that we can use but that we can be examined with the help of fMRI. It will also give some detail which is related to the emotional status of the particular person. So on the whole, these are the different types of different kind of psychophysiological measurements. We can go through any of this technique, if you want to measure if you want to measure or analyze or examine any different kind of psychological status of the particular patient. Okay, thank you.